Which of the following is true regarding medullary carcinoma of thyroid? It arises from parafollicular cells, secretes calcitonin, occurs in families, amyloid in stroma, commonly malignant. Which of the following factors contribute to the development of duodenal ulcer 131I? True about anaplastic carcinoma of thyroid, common in elderly, and lymphatic infiltration occurs. Indication of surgery in a case of thyroid swelling is cosmetic pressure symptom and swelling with symptoms. Treatment of papillary carcinoma of thyroid with bony metastasis, near total thyroidectomy with radioiodine and radiotherapy. Indication of thyroidectomy is cosmetic, neoplastic, and pressure effect. In pregnancy, radioiodine is contraindicated. A 32-year-old male with painless lymph node in cervical region, lymph node biopsy shows normal thyroid gland features. The thyroid is normal on palpation clinically. The diagnosis is papillary carcinoma thyroid. All of the following are early in life threatening complication of thyroid operation except hypocalcemia. So, which is the early life threatening complication? Tracheomalacia and collapse of larynx, wound hematoma with compression of trachea, and thyroid storm. Carcinoma arising from thyroid follicle is Hurthal cell carcinoma of thyroid. Treatment of medullary carcinoma of thyroid with lymph node metastasis is total thyroidectomy and radiotherapy. Compared to follicular carcinoma, papillary carcinoma of thyroid is bilateral, local recurrence is common, and increased lymph node metastasis. In video assisted thoracoscopic surgery for better vision, the space in the operative field is created by collapse of ipsilateral lung, which is not an indication of thoracotomy. Pulmonary contusion. The treatment of choice for anaplastic carcinoma of thyroid infiltrating trachea and sternum will be palliative or symptomatic treatment. Which of the following is the commonest tumor of thyroid? Papillary carcinoma. A 45-year-old male presents with 4 by 4 cm mobile right solitary thyroid nodule of 5 months duration. The patient is euthyroid. The following statement about his management are true except cold nodule on thyroid scan is diagnostic of malignancy is false. What is true is FNAC is the investigation of choice. The patient should undergo hemithyroidectomy if FNAC report is inconclusive. Indirect laryngoscopy should be done in the pre-operative period to assess mobility of vocal cords. Complications of total thyroidectomy include all except hypercalcemia. So, complications of total thyroidectomy are hoarseness, airway obstruction, and hemorrhage. Thoracic extension of cervical goiter is usually approached through neck. The following statement about thyroglossal cyst are true except IND is the treatment of choice is wrong. What is true is frequent causes of anterior midline neck masses is in the first decade of life. The cyst is located within 2 cm of the midline. The swelling moves upward on protrusion of tongue. Which of the following is not a histological variant of thyroid neoplasm? Merkel cell. So, what are the histological variant of thyroid neoplasm? Follicular, insular, and anaplastic. All of the following are true about lymphoma of the thyroid except slow growing. So, what is true about lymphoma of thyroid? More common in female and clinically confused with undifferentiated tumors. It may present with respiratory distress and dysphagia. A 20-year-old girl presents with 9-month history of neck swelling with thyrotoxic symptoms. On investigation, increased T4 and decreased TSH with palpable 2 cm nodule was found. Next investigation will be thyroid scan. This thyroiditis is also known as painless thyroiditis, subacute lymphocytic. There was a sudden increase in the size of thyroid swelling along with pain. Most likely the cause is hemorrhage within the cyst. Variant of papillary carcinoma of thyroid, columnar cell and diffuse sclerosing. Papillary carcinoma of thyroid is most common thyroid cancer. Psammoma bodies are seen. Thyroid storm after operation is due to inadequate control of hyperthyroidism. Thyroid carcinoma with pulsating vascular skeletal metastasis is follicular. Pendred syndrome is due to a defect in chromosome 7q. A central midline neck swelling is noted in a 4-year-old girl posted for tonsillectomy. The swelling is painless, mobile, and cystic just below the hyoid bone of size 2 by 1.1 by 1 centimeter. US showed a ultrasound showed a thick-walled cystic lesion. Management would include surgical removal. Vocal cord palsy in thyroid surgery is due to injury to recurrent laryngeal nerve. FNAC is useful in all the following type of thyroid carcinoma except follicular. FNAC is not useful in follicular carcinoma. Most common histological type of thyroid carcinoma is papillary type. Complication of hemithyroidectomy include all of the following except hypocalcemia. Investigation of choice in discrete thyroid swelling is FNAC. About papillary carcinoma, what is true is lymph node metastasis is common and it can metastasize to lung and multiple foci of tumor is seen. Regarding anaplastic carcinoma, which statement is true? It is common in elderly associated with p53 mutation and lymphatic spread may occur. Treatment of medullary carcinoma of thyroid is surgery only. Which of the following would be the best treatment for a 2 cm thyroid nodule in a 50-year-old man with FNAC revealing it to be a papillary carcinoma? Near total thyroidectomy with modified neck dissection. A person has fever and pain in thyroid gland. True statement is increased DSR. Radioactive iodine uptake is a 21-year-old woman has 3 centimeter node in the lower deep cervical chain on the left. The biopsy is interpreted as revealing normal thyroid tissue in a lymph node. The most likely diagnosis is lateral aberrant thyroid. Cyst trunk's operation consists of excision of hyoid bone and the cyst. Hashimoto's thyroiditis, true are all except orphan any eye nuclei. So what is true is follicular destruction, increase in lymphocyte and oncocytic metaplasia in Hashimoto thyroiditis. All of the following are early life-threatening complication of thyroidectomy instead of thyroid hypocalcemia. Symptoms of thoracic outlet syndrome are produced due to compression of C8T1 nerve root. A patient with multinodular goiter suddenly developed pain in and difficulty in breathing. Which of the following type of thyroid carcinoma is most likely to cause this complication? Follicular carcinoma. About papillary carcinoma, true statement is radiation is a risk factor. It is multifocal. Distant metastasis is seen and it is more common in iodine deficient area. Features of medullary carcinoma of thyroid is it arises from parafollicular cells. Amyloid stroma is present on histology and 10 to 26% cases are familial. Diarrhea occurs. Total thyroidectomy is performed. In which of the following conditions radioactive iodine irradiation can be used in Graves' disease, age more than 40 years, elderly, presence of associated comorbidities? Which of the following is true? Goiter, more than 5% of population is endemic goiter. Hashimoto's thyroiditis, true are all except orphan any nuclei. So what is true about Hashimoto's thyroiditis? Follicular destruction, increase in lymphocytes and oncocytic metaplasia. Which of the following would be the best treatment for a 2 cm thyroid nodule in a 50-year-old man with FNAC revealing it to be a papillary carcinoma? Total thyroidectomy with left-sided modified neck dissection. Treatment of medullary carcinoma of thyroid is surgery only. A well-differentiated follicular carcinoma of thyroid can be best differentiated from a follicular adenoma by vascular invasion. A 75-year-old lady is diagnosed of having a thyroid malignancy. Her serum calcium is low. What is the most likely explanation? She has medullary carcinoma. For thyroglossal cyst, most common site is subhyoid. Parathyroid and adrenal glands. The commonest cause for hyperparathyroidism is single adenoma. Most common cause of hypercalcemic crisis is carcinoma of breast. Commonest symptom of pheochromocytoma is headache. Hypoparathyroidism occurs as a result of following surgery, and the next cause can be idiopathic atrophy of parathyroid. Hypocalcemia in immediate post-operative period following excision of parathyroid adenoma is due to increased uptake by bones. In parathyroid crisis with sudden elevation of calcium over 16 mg per 100 cc, the treatment consists of Parathyroidectomy for removal of adenoma. Hyperparathyroidism is characterized by the following except osteosclerosis. So, hyperparathyroidism is characterized by generalized osteoporosis, renal caliculi, and hypercalcemia. Palpation on the costovertebral angle produces pain and tenderness in acute adrenal insufficiency. This is Rogoff sign. A patient has hypocalcemia, which was the result of surgical complication. Which operation could it possibly have been? Thyroidectomy. The symptoms of hyperparathyroidism include constipation and muscle weakness, anorexia and weight loss, polydipsia and polyuria. Commonest cause of for Cushing's syndrome is hyperplasia. A known patient with renal stone disease developed pathological fracture along with abdominal pain and certain psychiatric symptoms. He should be investigated for hyperparathyroidism. Not seen in neuroblastoma is splenomegaly, and what is seen in neuroblastoma? Diarrhea, proptosis, and bone involvement. In pheochromocytoma, the urine will contain VMA. False statement about pheochromocytoma? None. So every sentence is true. 10% are bilateral. It arises from chromaffin cells and extraadrenal tumor, increased noradrenaline levels, and increased VMA levels in urine. Opsclonus myoclonus is a phenomenon seen in neuroblastoma. Most common presentation of hyperparathyroidism is abdominal pain. A patient presented with episodic hypertension and headache with a thyroid nodule. The investigation of choice is urinary catecholamines plus aspiration of the nodule. Hypocalcemia is a feature of all the following except. So hypocalcemia is a feature of chronic renal failure, hypoparathyroidism, pseudo-hypoparathyroidism, and total thyroidectomy. After thyroidectomy, patient developed stridor within 2 hours. All are likely cause of stridor except hypocalcemia. So what are the causes of stridor? Recurrent laryngeal nerve palsy and laryngomalacia and wound hematoma. Hypertension is seen in all except. So hypertension is seen in adrenal tumor, pheochromocytoma, Cone syndrome, and neuroblastoma. Neuroblastoma's good prognostic factor is hyperdiploidy. Young female presents with hypertension and in VMA more than 14 mg per dl. It is associated with medullary carcinoma of thyroid, von Hippel-Lindau disease, Sturge-Weber syndrome, and neurofibromatosis. Primary hyperparathyroidism is caused by parathyroid hyperplasia, adenosis, and multiple endocrine neoplasia 1. True about multiple endocrine neoplasia 1 is increased VMA in urine, hypergastrinemia, and hyperprolactinemia. Men 2 uh, Men 2A includes all except ganglioneuromas. So Men 2A includes cutaneous lichenoid amyloidosis, mutation in RET in chromosome 10, parathyroid adenoma, and adrenal adenoma. Hypoparathyroidism following thyroid surgery commonly occurs within 2 to 5 days. Treatment of hypertensive crisis in pheochromocytoma is phentolamine. Indication for surgery in a case of adrenal incidentaloma is size more than 5 cm, bilateral adrenal metastasis, functional tumor. Incidentally, findings in CT scan are 3 cm adrenal mass. Which of the following is not done? Adrenalectomy is not done. What is done is dexamethasone suppression test, measurement of catecholamines, and midnight plasma cortisol. Indication for surgery in a case of adrenal incidentaloma is size more than 5 cm, bilateral adrenal metastasis, functional tumor. Which one of the following is not a CT feature of adrenal adenoma? Enhances rapidly, contrast stays in it for relatively longer time and washes out late is false. What is true is low attenuation, homogeneous density, and well defined borders. Calcification is rare. Breast retromemory abscess arises from tuberculous rib, infected hematoma, and chronic empyema. Most malignant type of carcinoma breast is mastitis carcinomatosa. In radical mastectomy, the structure preserved are all except pectoralis major. So, which structures are preserved? Axillary vein, cephalic vein, and nerve to serratus anterior. Estrogen receptor studies in carcinoma breast is done on tumor site. Secondary deposits from carcinoma breast is commonest in bone. Risk factor for carcinoma breast is sister dead from cancer breast and Jewish origin. Bleeding per nipple is seen in duct papilloma and carcinoma breast. Pseudo orange is due to Subcutaneous lymphatic involvement. Commonest site for carcinoma of the breast is upper outer quadrant. Gynecomastia may be in patient with all except. So gynecomastia may be seen in patient with uh, cimetidine therapy, cirrhosis of liver, and Klinefelter syndrome, but not in Turner syndrome. Bloody nipple discharge is usually associated with intraductal papilloma.